two, three, four. 525,600 minutes, 525,000 moments so dear, 525,600 minutes. How do you measure a year? How about love? How about love? How about love? Measuring love. Seasons of love. Seasons of love. 525,600 minutes, 525,000 journeys to land, 525,600 minutes. How do you measure the life of a woman or a man?
In truths that she learned, or in times that she cried, in bridges he burned, or the way that she died.
It's time now to sing out, though the story never ends. Let's celebrate, remember a year and the life of friends. Remember love, love.
Oh, you got to remember love. You know that love is a gift from up above. Show love, give love, spread love, measure your life in love.
Seasons of love. Seasons of
Welcome to Family Aid Boston's Building Better Futures event. Thank you so much for joining us tonight. I'm John Worrell, Chair of Family Aid Boston's Board of Directors, and we're just delighted that so many of you could join us this evening. On behalf of our families, I'd like to thank our supporters, including our event sponsors and our colleagues at Boston Children's Hospital and Boston Public Schools. We certainly could not be addressing the crisis of family homelessness in Boston without their incredible generosity. Thank you. We have a lot to share with you this evening, and we hope all of you will learn a bit more about the work we do and our proven solutions for helping children facing homelessness in Boston. I'm speaking with you today from outside of the Russell Elementary School in Boston. Tonight, as we gather, more than 4,000 Boston Public Schools students are homeless, and another 900 are teetering on the edge of homelessness. To address this, Family Aid Boston and Boston Public Schools have launched an ambitious plan to prevent more children from becoming homeless, and you'll learn more about that later in the program. Our drive to support children comes from research that shows without significant intervention, a homeless child is 8 times more likely to be homeless as an adult. We know that these interventions can work. We know they can change the trajectory of a child's life. The challenge is we need to do more, and we need to serve more children. And to do that, we need you. You can make these children's dreams and aspirations come true and help them build a better future for themselves. As you learn more about Family Aid Boston this evening, we hope you'll support us. You can do that by following the QR code at the bottom of your screen, by visiting our website, or by contacting us directly. Thank you in advance for your support. And right now I'd like to share a short video that shows some of the great work that the Family Aid Boston team is doing right now.
Before the pandemic, we were engaged with the Boston Public Schools and Boston Children's Hospital, looking at the number of children whose families were teetering on the edge of homelessness. We believe the best way to end homelessness is to prevent it from happening. Our plans were to provide housing services that would stabilize a family before they fell into homelessness. The pandemic truly changed all of that. Families lost everything. So Family Aid rushed in with additional supports. Today we're delivering over 7.5 tons of food and supplies to our parents and children each week. We're providing cash assistance to families. We're providing intensive housing supports and helping families stabilize or seek new housing as they struggle to make their way through the pandemic.
A lot of our families are single parent households. They depend on one income. They have minimum wage jobs, and so they're not able to really sustain long term. Families don't have a lot of support systems. So if a parent finds themselves at work and they get a call from the children's school saying that their child is sick, and sometimes they find themselves having to choose between keeping a job or staying at home because their child is sick.
We really want to see homelessness be a thing of the past. Housing is a basic need, and everyone deserves the right to have a place to call home. With Family Aid Boston, I've been here for over 12 years. We are committed. We don't do this for accolades. Like, we honestly do this to see successful outcomes for our families. For some families, we're the only support that they may have. So we really made a commitment and an effort to be there every step of the way.
When I wake up this morning, I was telling my daughter, she was telling me, "Mommy, today is the big day of our life. We're moving out. Our life is gonna change today. We're gonna have our new place, our new house. Look at the day, it's beautiful." Like say, Family Aid, it was there for us.
You know, issues with tenants and landlords, you know, because of my autistic son. Sorry. I mean, working with Family Aid, and you know that you're right as a human being, they have, you know, strengthened me a lot. I'm happy about it. I mean, it's not tears of sadness, it's just tears of joy that I have worked with this great team from Family Aid, and just by getting my freedom again, it means a lot. It means a lot to me.
So you won't find families sitting on the street asking for support. Instead, they're doubled up with other families. They're living in overcrowded conditions, and they're struggling to maintain that housing while they're also seeking employment and trying to get their kids back to school. In order to provide the right kind of care, we need more staff, more expert help, and more collaborators to make sure that we can wrap around a child and a parent to make sure that all their needs are being met. We're expecting that more than 3,000 children and parents will need our services next year, a 50% increase from where we are right now. And that's where private support and our staff of experts can help families navigate still challenging times as we come out of the pandemic.
Our children are the future, but they can't have a future if they continue to have to deal with the struggle. And if they don't get the opportunity to have housing stability, they're not going to thrive into successful adults. When you allow people the opportunity to thrive, the community as a whole thrives.
And honestly, it's gonna make me start crying, but that's like what motivates me to do this work every single day. Just seeing the families be able to move forward with what their goals are and really believe in themselves again.
For the children and parents in our care, the pandemic is far from over. And for thousands of other children and parents, they too will struggle getting through the pandemic if Family Aid doesn't step in. Our goal over the next year is to deepen our services for more children and parents, to support our partners in the schools and in the hospitals to make sure that children are getting the resources that they need and families have a safe place to live and stay rather than a hospital emergency room. Our goal really is to make sure that families' needs are being met, whether it's food, financial assistance, housing supports, or supports to help kids thrive in a changed world.
Good evening, everyone. I'm Laura Scott, Vice Chair of Family Aid Boston Board. I'm standing here outside the emergency room at Boston Children's Hospital, one of our leading partners in the fight against family homelessness. Each month, 100 children and parents wind up spending the night at emergency rooms just like this across the city of Boston. Imagine a 5-year-old sleeping on the floor of an emergency room. Imagine being the parent trying to handle multiple children sleeping in an emergency room because you have nowhere else to go. We must put an end to that, and to do so, we've established a partnership with Boston Children's Hospital and Boston Medical Center. This new partnership will help ensure that families have a safe place to stay and that they get the help that they need to be stable moving forward and stay out of homelessness. You've just had an opportunity to see our work. We now introduce you to a panel of experts who will share with you expert health, housing, and educational perspectives on the future of children facing homelessness and what we can do to stem the tide of dramatic increase of homelessness in this city. Moderating tonight's panel is Allison King, an Emmy Award-winning journalist from NBC. Allison?
Thank you, Laura, and thank you to all our viewers joining us this evening. We are humbled by the number of you who have given us your time and attention tonight. You've just seen some of the work Family Aid is doing and some of the families and children in their care. As I'm sure most of you know, Family Aid Boston is the largest provider of services dedicated solely for homeless children and families in Greater Boston, and it's my honor and pleasure to be moderating this panel discussion this evening. Please join me in welcoming our panelists. Larry Siemens, President of Family Aid Boston, Dr. Snehal Shah, a pediatrician and Associate Medical Director for Community Integration, Department of Accountable Care and Clinical Integration, Boston Children's Hospital, and Dr. Brenda Caselius, Superintendent of Boston Public Schools. Thank you all. I'm glad we can be together in a safe, socially distanced way, and all of you joining us should know that all components of this evening's event have been done following strict COVID safety guidelines, socially distancing, and wearing masks when needed. We are here this evening to learn more about child and family homelessness from our panel of experts, to hear how they are partnering to address the crisis in our city and develop sustainable solutions, and to learn how all of you may be able to help. Before we begin, some context. According to Save the Children's 2021 U.S. Child Report, 1 out of every 4 Boston children live in poverty. This is almost twice the national average. Moreover, more than 100,000 Boston children and parents are living on the edge and below the living wage, calculated by MIT to be $115,000 for a family of 3. According to the Federal Departments of Housing and Urban Development and Education, more than 40,000 children in Massachusetts, plus their parents, are living in cars, emergency shelters, emergency rooms, or in overcrowded, unsafe apartments. In fact, according to HUD's most recent annual homelessness report to Congress, Boston has the 3rd highest number of homeless children and parents in the entire country, despite being the 21st most populous city. Recent forecasts from the nonpartisan Economic Roundtable suggest that poor families continue to struggle, and those who make it out of poverty will likely fall back in and into homelessness, with family homelessness expected to reach record levels in 2023 as federal stimulus funds run out. These are all unsettling facts. Larry, Dr. Caselius, and Dr. Shah are all partnering to address this crisis with some innovative programming that are showing impressive results. My first question is for you, Larry. Why is it, from your perspective, that Boston has among the highest rates of child and family homelessness in the nation?
Thank you, Allison. That's a great question. I think the issue is that working families here in Boston are experiencing a perfect poverty storm. That's in addition to what's happening with the pandemic. So in the city, despite increases in the minimum wage, a working parent, single parent, would have to work 100 hours. That's 2.5 full-time jobs in order to make ends meet. The same parent actually has been reliant upon our schools and other service organizations and family members to help support their children while they're working all those jobs. And the pandemic's actually changed all that. Because of what's happened, many working class families and parents have lost their jobs or they have reduced work hours. And the folks that they've relied on, the community organizations and other services and family members, are not available to them or their children because of social distancing.
Yeah, I mean, this is staggering and it's distressing. As a 2018 study from another Family Aid partner, Boston Medical Center's Children's Health Watch, shows, that homelessness is developmentally harmful to the youngest children. So Dr. Casilius, could you start out by sharing what you're seeing in terms of the number of children who are facing housing insecurity and homelessness and the impacts on the pandemic on those students?
Well, thank you, Allison, and thank you, Larry, for your incredible partnership with Family Aid. This is such an important issue for us because a student who has stable home has greater chance at success in their education and in their schooling. And so in Boston, we are seeing about 4,000 students who experience homelessness each and every year. And that is just a staggering amount. It's about twice the national average. And so we should not be seeing these kinds of numbers in children. And so having partnerships like Family Aid, Higher Ground, and others, and partnerships with the hospitals is just a great way for us to help us identify where students are having homelessness and then plug in those gaps to provide the support and services. One thing during the pandemic we're seeing is that we actually haven't seen a huge increase, which you might anticipate because of all of the storm that we know that families are having, because of the eviction moratoriums that we've seen. So the creativity around public policy to fill the gaps with the eviction moratorium has been absolutely essential for our families. Also, rental relief programs have been another way that we've been able to help families stabilize within the area.
Thank you, Dr. Casilius. And Dr. Shaw, the next question is for you. Share with us a bit more about what you're seeing in terms of homeless families in the emergency room and in your practice.
Yeah, thank you again. I appreciate Allison being here and partnership with Family Aid and Boston Public Schools around this really important topic that's affecting so many children in our city. I think in our primary care setting, we do some we speak with families about sort of their the factors that are associated with keeping kids healthy. Housing and food security are a couple of those factors. And what we learned in our setting is over the last, in around 2019, so pre-pandemic, we had about 20% of families telling us that they have some concern about their ability to remain stably housed in our primary care setting, which is really staggering, right? A fifth of families coming to us and saying, wow, I'm not 100% sure we'll be able to sort of stay where we are, be able to afford where we are, concerned about the safety of the place and the conditions in which they live, which is staggering. I think that for us, the things that we see often in the primary care setting for kids who are in these sort of unstable housing situations are the sort of emotional and behavioral and mental health impacts on their lives, their ability to feel relaxed as a child. It's affected by the instability of not knowing sort of where they're going to be staying or that comfortable place to be as a child that you need, that secure place that you need. You know, if we think about it, your house is sort of the place that brings you stability, a bit of freedom. It protects you from the outside world, and all of those things are lost when you don't actually have when you don't actually know where you're going to stay the next day. And it has significant impacts both on the child and on the parent, which then affects the parent-child relationship. So, you know, the effects on the child are at the level of the house, are on him or herself, and then also potentially in that way that the parents are there for the child, which can be affected by the stress of not knowing, again, what's going to happen the next night, or being in a place that maybe is not home for them.
Thank you so much, Dr. Shaw. Dr. Casilius, I want to come back to you for a second. From your perspective, how would you describe the gaps in the current systems for homeless children, and how is the school system working to address them?
Yeah, some of the gaps, I think, in terms of accessing housing, the biggest one is demand and supply. I think, you know, that we have such a great number of homeless students, and getting them actually housed. We've been able to house about 486 through a voucher program in partnership with the city and our partners with Family Aid. And then being able to make sure that they are permanently housed. That's the wonderful thing about these vouchers that we have now, is that they're permanent vouchers. So finding the apartments, then being able to get into them successfully and get leased, I think is one piece that we're trying to fill that gap. And then I would say it goes back to what the doctor was saying about just the services that we provide and filling the gaps for them educationally, filling their food security gaps, kids who fall behind, making sure that they get the right tutoring and supports that they need. We've been able at Boston Public Schools to prioritize our homeless students in everything that we do, whether it's tutoring, getting summer school, they get early access to those opportunities. We're delivering meals to our homeless students. Brian Marks and his team, our specialists, just go out of their way. We brought them back sooner than other students to in-person learning and prioritize that because we know that they experience this instability, and we need to be the ones who step in and bridge that gap.
Thank you, Dr. Casilius. Dr. Shaw, you co-authored a groundbreaking Boston Public Health Commission study on the health of Boston's children. Could you talk a bit about rising risks that children are facing, homelessness experience, the long-term effects of housing instability on children, and the interventions that you think are necessary?
Yeah, so I think, what we have learned about this sort of housing instability, right? It comes in multiple forms. It comes in the idea that you don't have a place to stay, the affordability of your housing, the conditions themselves, and also sort of in the sort of your neighborhood, the way that sort of where you live affects who you are. And in each one of those domains, there's impact on child health. So for instance, the idea of being in an unstable housing situation, I mentioned before, the sort of emotional and behavioral health impacts of that. We see across age groups where you see behavioral dysregulation in younger kids and depression in teenagers. I think that when you think about lack of affordable housing, which is connected to stability, without those resources in the household, right, if you're having to spend all your income on staying in your home, you don't have resources for other things like the basics, food, medicines that you might need or that your child might need, ability to sort of spend some time on enrichment activities, right? Like the ability to have resources to help ensure that your child is healthy is much more limited if your housing is unaffordable. I think thinking about sort of where you live is also important when you're thinking about child health. The ability to play outside, the ability to be safe outside, the ability to find healthy food in your neighborhood, all of that influences health of children and the adults who care for them. And I think the idea that where you live, the conditions in which you live in, whether you're talking about a house that maybe has lead paint or a house where there is a pest infestation, again, all of that can affect the health of a child. And so I think when we think about this issue of housing and housing instability, we're thinking about all those different layers and how those layers can impact different aspects of the life of a child, the health of a child, as well as the health of the whole family. When we think about, interventions or sort of what we do about this work, about these challenges that families face, I always think about multi-sector, right? We need to work in healthcare, we need to work in the school system, we need to work with our housing providers, and the idea that, just one of those areas could manage all this for a family doesn't seem fair to the family. It feels like we really need to continue to figure out these innovative partnerships to support families in each one of these domains to help ensure, again, that the parents and the child are as healthy as possible.
Thank you so much for that, Dr. Shaw. And Larry, I want to come back to you for a minute. Could you talk more about family aid partnerships with the Boston Public Schools and Boston Children's Hospital, the collaborative solutions that you're working on to address child and family homelessness, and what you see as the path forward to build a better future?
Sure. Thank you, Allison. So for over 100 years, Family Aid has focused on providing emergency shelter and housing for families who are actually experiencing really the deepest and darkest parts of their lives, actual homelessness. And it's a vital service, and we're going to continue to do that because there's a tremendous need here in the city. However, over the last several years, working with our partners, we've come up with some new strategies. So I believe the three organizations we believe that the best way to end child and family homelessness is actually to prevent it. So in our partnerships, what we're working on is to make sure that families who are unstably housed have the resources and opportunities that they need to prevent their eviction. So through some new technologies and our collaborative efforts, Boston Public School teachers and Boston Children's Hospital clinicians are identifying children and parents who are unstably housed, who are on the precipice of homelessness, before they're actually evicted. And through our technology, clinicians and teachers can actually reach out to family aid staff who then immediately intervene with the family to provide resources that they may need to either stay stably housed in good housing or to quickly move them to better, newer, and safer housing. So that's the core component of our program. Because of the pandemic, however, we've had to do some other innovative things together. So for example, we are delivering food to make sure that families have food security. And then for children who have really experienced the really darkest days, we've tried to bring some joy to their lives through a very expanded enrichment program. And the results have been really fantastic. Because of our work together, we've actually housed 486 families in the last 12 months. That's over 1,200 children and parents. And for the remaining families who have come to us, we're actually helping to keep them stably housed. The program that we designed was actually designed for 300 children and parents. But with the pandemic, actually we're serving over 2,000 children and parents tonight. So when we talk about solutions, I believe that we're onto something, that we actually have a model. It has to do with really comprehensive wraparound services with a real eye to the importance of children's healthy development. That's really the key. The challenge for us actually, and the path forward, is to continue doing what we're doing, but actually to do more of it for more children and parents who need our services.
It's really fantastic work you're all doing. Thank you, Larry. And a final question for all three of you. Given where we are with this pandemic and all of the research that says that homelessness will undoubtedly rise as a result, what gives you the most hope for the homeless children in your particular environments? And Dr. Shaw, I'll start with you.
You know, I think what I often think about is that, you know, when we come across a family that's having a challenge such as housing instability, we need to continue to think not only about their challenge, but sort of the assets and the strengths that they bring. And I think that's the thing that brings me hope when I work with these families and when our teams and our clinics work with these families, is that each member of that family, each child has a strength and assets that they bring to this difficult situation, and that resilience comes through, that they are able to withstand some really difficult times and still find a little bit of laughter, a little bit of connection and bonding. And I think that as I think about what's coming ahead and the unknowns still related to the pandemic, I think part of our job is to really focus on those assets and to strengthen and help support that resilience that already exists in children and families. And yes, there are these challenges, and we're working together to help support families through these challenges. We also need to continue, as we do, acknowledge that there is a lot of, again, strength and resilience and assets that families come with, and that coupled together, we can actually support families as we get through these difficult times together.
Thank you so much for that. Dr. Casilius, how about you, and what brings you hope?
Well, I'll start with a personal story that, I was a child of a mother who had my daughter at 16 and had me at 21, and we were on welfare, and I myself lived in public housing, and we lost that and ended up at grandma's house for a year. And so I know firsthand what these programs do to stabilize families, and it's absolutely critical. So what brings me hope is that these types of programs, this type of support, and with the renewed focus from our new president and vice president in Congress, focusing on families and focusing on children, I think that provides me a lot of hope. These new policies and the new budget that the federal administration is taking on, and the coordination that they're all doing at that high level, will mean that resources will flow to the state and local levels because that's exactly what we're going to need, types of scaffolding to support so that children don't fall between the gaps.
Thank you so much for that. And Larry, I'm going to let you have the last word on this.
Thanks, Allison. Thank you to our guests and partners this evening for your incredible support. So I think that's what gives me hope, in addition to children's resiliency and parents' resiliency. And the thing probably that I'm most encouraged about are the support and generosity of parents and family who have a stable roof over their heads and whose kids are actually sleeping safely tonight. So I believe that it does really take a village to help children. And I believe that this village and the village of our audience tonight actually can wrap around and support children and families in need. So person to person, family to family, I think we're going to be here to help more children and parents who are in need.
Well, thank you all for your insights. It has been a pleasure being with all of you this evening. There is no question that the collaborative work you're all doing to address children's homelessness is critical and is having tremendous impact. And now I'm going to turn it back to Laura Scott. Laura?
Thank you, Allison, Dr. Casilius, Dr. Shaw, and our own president, Larry Siemens. Additionally, we thank this evening's underwriters. We could not do this without your partnership and support. Thank you. You've now seen our work. You've heard about the challenges and the possibilities for the future. Now we want you to hear from the people who matter the most, the parents and children in our care. Tonight, they will share with you their hopes and dreams for a future without homelessness.
What was the hardest thing about living in a shelter or not having our own home?
Not getting myself clean because I always felt dirty on the inside.
So, Xavier, how did it feel when I told you that we might not know where we're going to live? Like emotionally, how did it make you feel?
Emotionally, kind of scared.
What is the hardest thing about not having your own home?
Get a good nap.
You can't get a good nap? And why not?
Because we don't have a comfy bed.
We didn't have a comfy bed. Yeah, that bed was kind of hard.
Amara, how did it make you feel when I told you that we might not know where we were going to live?
It made me feel sad because we had nothing to eat or nothing to drink.
Do you know what it means to be homeless?
Yeah.
Okay. What does it mean?
Well, it means poor or something.
And what is the hardest thing about not having your own home?
The hardest thing is finding a place in the first place.
Why do you think every kid deserves a home?
Because they need food, water, pillows, a comfy bed, and posters.
What does having a home mean to you?
I could go take a nap.
You can go take a nap whenever you want to? Yeah, that's what it means to you?
Yes.
What does having a home mean to you?
It means having my own space.
Are you happy about your room? Yeah. What does it look like?
I have a lot of dinosaur blankets. My dream bedroom would look like a epic gamer room. I'd have a swing.
You have a swing? What else?
And have a bunch of TVs.
A bunch of TVs?
Yeah.
For what?
So I can eat, so I can watch TV and play on my Xbox at the same time.
Really? But how can you focus on both at the same time?
I don't
What do you want to be when you grow up, and why?
I want to be a police officer because I want to save the world.
What do you want to be when you grow up?
A doctor.
A doctor.
What do you want to be when you grow up?
I want to be in the military.
In the military? Yep. What branch?
The Air Force.
The Air Force?
And what do you want to be when you grow up?
I want to be a YouTuber, a designer, and I want to make games.
What I want you to be when you grow up, I want you to be happy, safe. I just want you to be happy. And know that you were loved severely by me, by Family Aid. Like, we wouldn't have what we have without you guys.
I'm much happier now. Much happier, much happier. I wake up happy. I clean. I'm able to just, I dance a lot, you know? I enjoy it. I enjoy my apartment. And without Family Aid of Boston, I don't think I would be there today.
So I'm grateful. We're grateful, right? Yeah. Yeah.
Good evening. I'm Kevin Costello, a Family Aid board member. I'm talking to you from our Brookline shelter, where we house and support 100 families and children. We designed this shelter so that families here have better access to medical and academic support, the services that will change their lives for the better. As you've heard, for all our good work and with all your generous support, there are currently hundreds of children and families still teetering on the edge of homelessness. They are living in cars, they are doubled up in crowded apartments, and showing up seeking safe shelter for a night's sleep in an emergency room. You've heard from children in our care. And you know, folks, their dreams and hopes are not unlike those of our own children. Please, think about what you've heard tonight. Think about what you have just seen. And think about the wonderfully positive impact you can make for hundreds of children and families who need your support tonight. I'm thrilled to tell you about a challenge grant that's being offered this evening. We have $50,000 challenge grant that's being offered by 2 committed donors to help us care for the children and families who lack the stability and safety of a home, even as we speak. For every dollar pledged by you, we will earn a matching dollar, 1 for 1, up to $50,000. Imagine the impact you will create for hundreds of homeless children and families. So please, make a gift now and help us ensure that we will secure the full challenge grant to help the families and children in our care. Please use the QR code in the corner of your screen. That will take you to the Family Aid website, or go directly to the Family Aid website, familyaidboston.org. And if you would like to speak further about supporting Family Aid, please reach out to Eva Barnes at evab@familyaidboston.org. Thank you so much for joining us this evening, and we thank you for the support of Family Aid. Thanks again, and good night.
525,600 minutes, 525,000 moments so dear, 525,600 minutes,